My name is Nick Cutter. I'm a physical therapist here at OrthoSouth, and today I'm going to be giving you a brief description about the McKenzie Method and MDT, or Mechanical Diagnosis and Therapy, and how we use it here at OrthoSouth to help treat our patients and get them back to feeling well again. So MDT stands for Mechanical Diagnosis and Therapy. The way that we use it here at OrthoSouth, it helps us to classify our patients based on their presentation symptoms, their history of the injury or symptoms, and what that does is it helps us to classify them and speeds up the process of determining what's the best course of treatment for each individual patient based on that classification. Okay, so this is just a short video demonstration of the McKenzie or MDT method. We've got Catherine here who's volunteered. So assuming we've already gone through a complete and thorough exam of her neck or cervical spine, we've determined that her complaints, her neck pain, is coming from a mechanical origin. So we would then move into a repeated movements screen, and we're going to show you a couple different examples of how we would do that here in the clinic. So to start, Catherine, can you sit up nice and tall? Good. There. And I'm going to have you do retraction. So I just want you to take your head, your chin, and just go straight back for me a couple of times. Normally we would have the patient go through and try 6, 7, maybe 8 repetitions and then reassess their symptoms afterwards. So go ahead and try that a couple of times for me. And so there's 1, good, that looks good. And 2, that looks good. And then, so fast forward, she's done 5 or 6 more. There's been no change in her symptoms. She still has neck pain when she looks over her left shoulder, for example. So the next thing we would do is called a forced progression, and that's where we would apply overpressure. There's 2 ways that we can do this. The patient can apply their own overpressure, or the clinician, like myself, could step in and apply that overpressure. So assuming we've already had Catherine go through and try it herself, I'll step in and I'll demonstrate how we would do cervical retraction with the clinician providing the overpressure. So again, kind of same position, so you're just up nice and tall. And I'm coming in back here. That looks good. Just look straight ahead. I'm just going to gently put my hand here on your chin. So I'm going to ask that you go ahead and retract back as far as you can. Great. And then I'm just going to give you a little overpressure there, and then we relax. Good. We'll try it again, all the way back on your own. Good. A little overpressure. And back. Good. That feel okay? Mm-hmm. So fast forward, we've done that 5 or 6 times, and then I would reassess Catherine's main complaint, which was pain when looking over her shoulder. So can you look over your left shoulder for me, please? Look at that. How does that feel?
Feels good.
Good. And that is an example of the MDT or McKenzie Method for neck pain.